help me with the pronunciation of your surname. I'm not sure I know how to go about it.
Mbadugha. Try.
Mbadugha.
Yeah, well done. That's fine.
Okay, I can live with
Mhm.
that.
Yeah, that's fine.
Okay, so we're going to go live. Love music and love life. You are now listening to Soul Sisters, and this is the show you listen to every Wednesday from 11 till 11:50 on your Love Music, Love Life radio station. We are Smooth 98.1. Right now, the time is almost 2 minutes past 11 o'clock, and Soul Sisters is about discussions for women, with women, and well, by women, and on some days, men. We thank you for being a part of it. And every Wednesday, like I told you, from 11 till 11:50, you will hear different things, any and every topic that has a woman or has women right at the center of it is what we have here. So from health to finances to development, leadership, everything, literally. And if you're in doubt, you can always go back to our YouTube page and search for Soul Sisters 981. Once you see a lot of videos with that hashtag, you can click on any of it and see the one that catches your fancy and rewatch some of the past episodes and catch up on some of the past discussions. For today, you would have seen the flyer if you're following us across all social media platforms or you're a part of our WhatsApp family. And if you're not doing any of the above, I think you should do it. So WhatsApp is 0809 4440981. We can always save your contacts so that you will see our status updates. And then on Instagram, it's at Smooth981. On Twitter is at Smooth981FM. My name is Oluwaseun Olusegun. And this morning we'll be talking about understanding women's eye health. Understanding women's eye health, because I came across some interesting statistics that I wouldn't say they were exactly interesting. They were enlightening, eye-opening, pun intended, because I didn't know that before now. And it said that women are more likely to have visual impairments compared to men. Now, there were a number of things that have resulted in that, and we'll get to understanding that. Also, we will get to knowing the risk factors as well as some lifestyle choices that women may be making that might even be increasing the chances for these impairments and challenges. And also, we'll talk about the hormonal interactions and a woman's eye health. That is another kettle of fish. So for the next 45 minutes, it's going to be absolutely enlightening. You can join us. So to do justice to that topic, I do have a woman of many talent who wears comfortably many hats. She is a multiple award-winning author. She's an editor. She's a poet. She's an artist. She's a songwriter. She's a playwright. And most importantly for this conversation, she's an ophthalmologist. So please make welcome Dr. Chigozie Mbadugha. I hope I got that.
Yeah, you're good. Hello, everyone. Thanks for having me, Oluwaseun. Thanks for having me.
Thank you for being here. And it's lovely to have this. I'm looking forward to this conversation that is starting right now with me trying to understand how you are able to combine all of these things. I mean, if I try to read your profile, we're not going to stop for the next 50 minutes. You're a researcher, you're an ophthalmic surgeon, you're an author, your short story, Breaking Chains was shortlisted for the 2024 Uwamaka Okoye Literature Prize. Your novella, Rude Awakening, was selected by the United Nations SDG Book Club. So many books that you've written, making it out there. And I'm just curious, how are you able to combine all of that with being an ophthalmic surgeon and researcher?
Well, I think first of all, it's God's grace. And I think when you're doing something you enjoy, it doesn't look like work to you. Because people ask me, where do you find the time to write these books? And basically, I've always loved literature from childhood. I wrote my first book when I was 6. never got published, but it's still there. And I just love books. So when I write, I'm not struggling. It's more like unwinding for me. But then there's got to be some bit of time management as well. I find that I can't attend as many social functions as some colleagues, and yeah, some people are not very happy with me, but I'm able to manage my time basically. But I love writing, I love reading, I love what I do. I love my work as a doctor, as an ophthalmologist. I just love it. So somehow I find a balance. I try not to put myself under pressure. I take my time. When I have free time, I write. When I don't, yeah, I'm not writing. So that's it, really.
It looks like you're very much involved with children literature. Can I ask why?
I love children. I love children. It's actually my happy place.
Oh.
Yeah, I keep saying that if not that I pediatrics was an option for me actually, but I hate seeing children ill, so I'm happy to look after their eyes. That's fine. and, and leave the rest to the more serious issues to pediatricians to sort out.
So if you were to give any career advice based on what you do to any woman who's trying to juggle so much, what would you say to them?
I'll say please cut yourself some slack. Don't get stressed up, don't get so pressured. I know that recently I wanted to submit an application for a contest, and 1 week later I was like, oh, what's the deadline again? Oh yeah, it's passed. And I just moved on. I cannot be fixated and get all worked up that, oh, I missed a deadline. No, there'll be other things, there'll be other opportunities. So I'll just say, do what you can, make sure you're enjoying what you do, and cut yourself some slack. If you can't keep up, cut out some things and, focus on what is majorly important to you.
Words on marble. Thank you very much for sharing that. Now let's get into the meat of this discussion. And I'm going to start by talking about one report I found, according to the Lancet Global Health Commission and Global Eye Health Vision Beyond 2020 report. They said that women have a higher prevalence of age-related macular degeneration, cataract, dry eye, glaucoma, refractive error, and thyroid eye disease. All of those, please break it down in layman terms. Why?
Yeah, it's thought that women are actually, if you talk about blindness or visual impairment, if you're looking at 3 people, 2 are likely to be women. That's an International Agency for Prevention of Blindness finding. And it's thought that women are 8% more likely to go blind, and about 15%, they're also more likely to have moderate to severe visual impairment. So you've listed some diseases: age-related macular degeneration, cataract, glaucoma, dry eye, thyroid eye disease, refractive errors. I'll tone down on a few. Let's start with dry eyes. When people have dry eyes, they tend to have irritation. Some may have itching. Some may have gritty sensation. They say, oh, I just feel like there's sand in my eye and I'm trying to remove it. And there's an association between hormonal changes in women and that feeling of dryness in the eyes. And we know that women go through a lot of hormonal changes as they are growing. Menstruation has hormonal changes, pregnancy has hormonal changes, menopause has hormonal changes. And, it's quite individualized. Some people have headaches when they're on their periods. Some have difficulty focusing. So there are so many issues that come with hormonal changes. We all want to get pregnant, procreate. A lot of women want to. And a lot of women take on that challenge despite the risk to their health and all of that. And that's lovely, that's motherly. And there's not much we can do about that. But dry eyes, when people have dry eyes from hormonal changes that we're not able to do something about, there are options. There are lubricants, some are preservative free, some have preservatives. Some talk about having an increasing omega-3 fatty acids in our diet, which we get from fish, especially the oily fish. Some talk about when it's really excessive, we can actually do punctal plugs. So we block where tears flow out of the eye from, so that the tears the body is producing last longer in the eye. But that we usually reserve that for very severe dry eyes. So yeah, women do have a lot of issues that are related to just being women. Generally, women tend to live longer than men, even in Nigeria. And they tend to have a higher prevalence or a higher incidence of these diseases that come with age, like the cataracts, glaucoma, age-related macular degeneration. Glaucoma is a whole spectrum on its own. I'll talk about that separately. But then some of these diseases become more prevalent or more common when people are above 40. And so if women live longer than men, they are going to get to an age where there are more older women alive and they are more likely to have these diseases. We all pray for long life. So basically, we can't stop some of the things that come with aging. But what we need to do is to have very regular eye examinations. Sometimes I tell my patients, around your birthday, just go and have a comprehensive eye exam. Walk in, tell the doctor, oh, I just came for an eye. Let it be a treat to yourself. I just look into my eyes. I know that I'm predisposed to some of this by being Nigerian, being African, being Black, being a woman. So because early detection is crucial. There are some things we can't prevent from happening. We can't prevent some of these diseases from happening, but we can prevent the effects that they have on people, on our lives, on the quality of our lives, on our jobs, on the care we provide for our families. So it's regular eye exam is crucial to be able to detect them early. Healthy diets are important. And then this is actually very peculiar to women. We've got to be able to take care of our eyes, our makeup, proper eye makeup hygiene. Sometimes with all these our artificial lashes, we've got to be able to use them correctly in a way that we don't endanger our corneas and have glue getting into the eyes. I've had patients that had that. So we've got to be able to do that. We've got to be able to replace eye makeup regularly and not share makeup so that we are not sharing infections. So it's a different ball game for women. And then you know that a lot of times women multitask. Like you said, okay, I'm a wife, I'm a mother, I'm a doctor, all of that. And then women also look after their parents. So a lot of times women get so busy and they ignore symptoms. Oh don't worry. It happens so once in a while like that. That's how it does. So we tend to push our needs to the back because we are so engrossed in caring for family, for other people, a bit like altruism. So we actually need to consciously prioritize our eye health and say, yeah, I know I'm looking after children, but I've got to have good vision to be able to look after my children properly, to be able to look after my family. You might see a woman say, oh, I've not been able to read for 2 years and she's struggling with focusing. And she hasn't been able to carve out that time to go to the eye hospital and have her eyes examined. And then the truth of the matter is that a lot of our eye health facilities are actually under a lot of pressure, they're overwhelmed, and there's a long waiting period, and the woman is looking at her time. I have to pick Junior from school at 2 p.m. If people cannot see me today, I'm going. I don't know when next I can come.
You still with us? Okay, so I guess we need to fix that network up and we will be right back. Now, in case you're joining us for the first time, you are listening to Soul Sisters. And for today, the topic of discussion is understanding women's eye health. As my guest this morning is Dr. Chigozie, and she's an ophthalmic surgeon. We're talking about the different things that, well, contribute to women having the higher chances of developing eye-related disorders or challenges or conditions. And that's what we have been on about for the past 15 minutes on Soul Sisters. If you'd like to be a part of this discussion, we've got the WhatsApp line that you can use in asking your questions or making your contribution. And WhatsApp line is 0809 444 0981. Again, the WhatsApp line is 0809 444 0981, while the call line is 0201 448 9981. We're streaming live on YouTube, so that allows you to watch, share with someone who's not necessarily in the same place or time zone with you, for you to go back and rewatch at your convenience, and also for you to just keep it there for the sake of documentation purposes, or, when you decide to go and gift yourself that gift or that eye checkup, birthday gift, whatever it is, you can always go back and hear some of the things that have been listed that you need to check. Welcome back.
Thank you. Thank you. Sorry about that. So we actually need to prioritize ourselves. It's not selfishness. We're actually prioritizing because we care for our families. It's also important. Then in our environment, we need to remember that there are gender roles assigned to women. There was this study done in Nigeria. It was a large national study, the Nigerian National Visual Impairness and Blindness Survey. And they did surveys in communities in the six. Especially in the north and in rural areas, because they were dependent on the men for permission to travel, for permission to go to the hospital, for funds as well. So women need to be empowered enough to take some health decisions. Oh, my eye is hurting, I need to see a doctor. And they need to be able to do that. You find some people say, I couldn't go because my husband was not around, so I had to wait for him to come back from a trip. All of that is delay. And in healthcare, delay isn't good. Delay worsens the prognosis of diseases. So things turn out better. Outcomes are better when we're able to intervene faster. And then we also know that awareness is lower in women. A lot of times, especially in the rural areas, a lot of women actually don't know that this is a problem. You might see someone with a huge growth, like let's talk about the thyroid eye disease as well. You may have a goiter, a huge neck swelling. Had it for 10 years. And then they're not observant enough to know that, okay, the enlarging eyeballs is related to this neck swelling. And sometimes the specialized care is not available. It's not, widespread. You might have to travel to another town to see an endocrinologist for the neck swelling. You might need to travel to another town to see an ophthalmologist. So we find that a lot of our health facilities are concentrated in the urban areas. And the people that sometimes the people that actually need this care are not able to access these services, either for logistics of distance or logistics of funds being available, or even being aware that, there's something they can do about it. There are so many people walking around in Nigeria with spins, and my eye has always turned out from when I was in primary school. They used to call me 4 o'clock eyes, and they're actually not aware that, I can do something about this. I may have developed a squint because this eye is weaker than the other, and all of that. So it's the awareness is not there that there's something I can do about this condition. And then we also have our cultural beliefs. It's a big issue. This I fight with women over. And sometimes that comes when they are now in a position to take decisions for their children. You see a 5-year-old who is putting books really close to see, who is sitting right in front of the television, and the mother says, ah, move away, move. But the child is sitting there because the child cannot see. And that is the truth. So if this child could see, who wants to sit very close to the TV? So for us as women as well, we need to be aware that some things we see in our children, they actually cry for help. When a child is putting books up close, getting close, that child is not seeing well. And then sometimes I hear parents say things like, okay, so if these 4-year-olds start wearing glasses now, when will they stop? The truth of the matter is that there's something we call amblyopia in children, and we call it lazy eye. That if an eye cannot see between 0 to the age of 10, then that eye becomes lazy. And because there are connections between the eye and the brain that take place within that age. And if it didn't happen, if that neural connection didn't happen, it will never happen. So you find a child 18 not seeing with an eye, and then you do your test, you find that this is the lens that this young girl or young man should be using. You put it there, they can't see because that connection didn't take place. As mothers, we need to be aware of the eye care needs for ourselves and for our children as well. So I always tell them, within the age of, if a child is 6 months old and needs glasses, please let them wear it. From 0 to 10, 11, 12, let them wear their glasses. Let these connections take place. If they don't take place, if they don't want to wear glasses after that age, that's fine. Well, we know that the anatomical connections are already in place. Yeah.
Wow. Thank you. That was a very detailed, certainly more than an introduction, but you've laid quite the solid foundation and helped us to understand why such things are happening. Okay, so now I want to take you back to something you mentioned in passing, but it's something I've thought about many times, especially in this age and time where it looks like makeup is inevitable.
Yeah.
So I worry about the eyeliners. And part of the reasons why I'm asking is because of that cultural thing you mentioned, as well as maybe some religious belief. I know that there was a time I would hear people say, oh, Kajal it washes your eyes. It helps you to see better or something like that. That's one part of it. The second part is all those things we use on our eyes, maybe the eyeliner, the mascara, and whatnot. What repercussion does it or do they have on our eyes? Because one time mascara got in my eyes and my word, it stung like hell. And I was worried. It felt like I was going blind immediately. So I can only imagine the number of chemicals we've piled and we will still pile into our eyes. What are the repercussions?
Well, all of these makeup, some of them are actually made from organic things and fewer chemicals than others, but they are all allergens. They are things that the body is not used to. And chemicals in the eye some people react, some don't. But like you said, you had an uncomfortable experience with mascara in your eye. That alone tells us that all of these artificial things can have repercussions. I can't tell women not to make up. It's hard, and they'll probably just go off air. Please let this doctor just come back after this show, you know. So I'll just say let's be cautious in what we use, and let's stick to products that are organic, products that are that have less chemicals, and products that we are not reacting to. And then let's be cautious in our application. Eyebrows are usually fine, it's far away, but mascara, eyelashes, I think they should be, I wouldn't say don't use, but I'll say use with caution. And if you react to a particular product, you need to know that, yeah, this one is not for me. And you need to find something that is compatible with you. So it can cause irritation, it can cause allergies, it can actually cause staining of the conjunctiva. Long-term use can cause some staining of the conjunctiva inside the eye. So if you pull down the lid, you might see a darkening of the skin inside. So they do have issues. They do. And some studies have shown that on a long term, they can actually be, causation is difficult to prove. Someone can say, oh, this is what caused this. It's very hard to prove in research. You can just say it's associated with this. So I don't want to go into some other more serious health conditions that people say chemicals can cause. And that's even beyond the eye. Goes as far as perfumes, as far as creams, as far as lotions. So there's a lot that people have associated with different health problems. So it's about being cautious, it's about being careful, it's about being observant. Yeah.
I'll still stay on that for a bit.
Okay.
Ladies who fix semi-permanent lashes, is it lashes now or brows? I believe it's lashes. Do you have any word for them?
I'd say be careful. We've had to separate eyelids and literally pull them apart from glue. I know there are glueless lashes now. I think I would say don't jump on a trend. Don't jump on a trend because someone got away with it doesn't mean all of us will get away with it. People have had liposuction and they were fine. And some people had very bad experiences with that. So I'll say don't jump on a trend. Lashes are close to the cornea, and the cornea is responsible for nearly 80% of the refractive power of the eye. That means the cornea is that glassy part. When you're wearing a wristwatch, there's a glassy part covering the dials of the wristwatch. So the cornea is like a glassy part covering the rest of the eye. In that, covering the black of the eye, the iris. And that's responsible for 80% of the power of our eye. And the lens and all of that, another 20%. So it's a very important structure. It's important because it needs to be clear for us to see clearly. So if we have lashes that are touching the eye, there's a disease that is prevalent in the north. We call it trachoma. And with trachoma, you have inturned lashes, which then poke at the cornea, they abrade the cornea, and over time, the cornea becomes opaque. And people have seen there's a connection between chlamydia conjunctivitis in childhood and intern lashes in elderly women. So it's a continuum. And it took a while before people realized that the infection in a girl child or in a child is what actually predisposes them to the scarring of the lid, the interning of the cornea. So anything that is close to the cornea, and that's why people ask me about contact lenses and all of that. That's another ball game altogether. There's cosmetic contact lenses, there are therapeutic ones. Contact lenses are great if you can handle them, but they can be a source of very severe infection if one is not taking care of them properly or handling them properly. And that can actually cause visual loss ultimately. So anything around the cornea, we need to be careful. People have made homemade solutions instead of buying the contact lens solution. People have used daily wear contact lenses for extended periods. All of those habits are dangerous. And then we have contact lenses that you need to take out every night, and some people fall asleep and forget. So all of that, people go swimming with their contact lenses in place without safety goggles. So there's so much that so those are lifestyle choices that are dangerous for our health, for our eye health, which we need to be conscious about as women.
Thank you. If you're listening for the first time, you are joining us on the conversation about women's eye health. And it has been really, really great in terms of the information that we have had and more knowledge that we've been able to pack on. So if you have any questions you'd like to contribute, you'd like to just say one or two things on your mind, or something you even heard at one point or the other, and you wanted to confirm if it was true or not, you can. And the WhatsApp line to do that is 0809 444 0981. Again, 0809 444 0981. While the call line is 0201 448 9981. So about myths, there's something they used to say that when you cut onions a lot, it's going to wash your eyes clean and it's quite therapeutic. Is there any truth to that?
I don't agree. I don't
Because that
agree
means
at all. If you want to wash your eyes, please get a lubricant, preservative free, instill it as much as you like and let it do the washing. I wouldn't advise that at all. I wouldn't.
Thank you. And I am going to go back home and start this trouble because many times, because there is the other part too, when some say the more you work in the kitchen or you use onions, the more you cook, the lesser it stings you. And that thing and my eyes are not friends at all. And you have people coming up with different thoughts. I'm not a fan. Thank you. All right, so we'll take a breather, and when we come back, we'll be getting into the topic, or still on the topic of eye health. I would like to ask pregnancy, because I came across that thread on social media about how a lady detailed her story, how she almost went totally blind because of pregnancy. And I was worried. Okay, before we go on that breather, let me take this call quickly. Hello, good morning.
Hello, good morning.
Good morning. What's your name and location?
I'm from Ikoyi.
Thank you for calling. Do you have any questions or contribution?
Question, please.
Please go ahead.
Okay. I use glasses and I've gone to see my ophthalmologist. But for some reason, my left eye is not so clear. At times, I feel like maybe something is causing my eyes. No, there's nothing. And she has checked me, her recommendations, nothing. But I'm still worried.
So what to do, right?
Pardon?
So you want to know what to do?
Yes, I want to know what to do. Is it normal?
All right. So I guess you will answer your question. You can keep listening. Thank you.
Okay, thank you very much.
All right.
I didn't hear that very well. Could you just summarize?
Oh, okay. So she says she uses glasses, and
Okay.
she's been to her eye doctor, and
Okay.
the left eye, it's I think a little bit cloudy, according to
Okay.
what she said, and it's been checked a number of times, but it's not exactly like the other one. So what can she do about it?
Okay. Well, I'd like to ask if what she needs to know, what I'd like to know is if with her glasses both eyes are corrected to the same extent. Because sometimes we have what we call anisometropia. That means that both eyes have different errors. I've got a weaker eye than the other. So the power in one eye is almost double the other in terms of the lenses I wear. And it's always been like that from childhood. So it's quite unusual to have everybody have eyes at the same level of vision or status. So it's not uncommon to have that. But if with her glasses correction, the one eye that is weaker is not fully corrected, we need to find out why. But if it gets to about the same level, she's able to read about the same chart with correction, then it's fine. It's fine.
Okay. All right, then please let me know, Catherine, if your question was answered. Otherwise, you can call back so that we clarify it and you have better information to work with. We'll take a short breather, and when we come back, we'll be continuing in this conversation about understanding women's eye health. You're listening to Soul Sisters on Smooth 98.1. Okay, so it's just a short break, and then we come back and pick up and talk about why a woman almost went blind because she was carrying a baby.
Yeah, that's right.
I know of women who have memory retention issues as a result of pregnancy. And I cannot deny that sometimes there are those things that fuel my fear of getting pregnant. I'm like, do I want to have a
don't
baby?
be scared. Please don't be scared.
Yeah. And let's not even mention hair loss and all those things.
Oh, don't go there. Don't go there. It's as if you're reading my mind.
Love music, love life. You are listening to Soul Sisters on Smooth 98.1, and it's about women. Being a woman is so beautiful, yet complex. Our body is such a wonderful mystery, and we're getting to understand just one part of it, our eyes, and some things that can, that can come to you without you exactly understanding why. So we've mentioned a little bit about hormonal interactions and your eye health. So now I am curious. I want to understand why a woman had a baby and she almost went blind. So my guest this morning is ophthalmic surgeon, Dr. Chigozie. So please, what happens when a woman is pregnant? Or besides that, maybe after that, we'll go to the menopause and how some also report signs of that as well. But I'm particular about that pregnancy part.
Okay, well, pregnancy is a period that has so many changes. And there are so many things that pregnancy does to the body as well. A lot of people, some women develop diabetes in pregnancy, and after they put to bed 6 weeks, 3 months down the line, their blood sugar control is better. But we do know that pregnancy affects the control of sugar. So it can actually tilt someone who was borderline into frank diabetes that is related to pregnancy, which can resolve after the pregnancy. But as many as 50% of women who have gestational diabetes will go ahead to develop diabetes in their lifetime. And then pregnancy, because it worsens blood sugar control in people that are already diabetic, predisposes them to diabetic retinopathy, which can be quite severe, difficult to control, difficult to manage. So there are many reasons why a woman can actually lose vision in pregnancy. And that's one reason why we need to keep checking our eyes, because even the hormonal changes in pregnancy affects corneal thickness, affects the refractive status. But sometimes if a woman comes and says, oh, my vision is blurry in pregnancy, and we look and there's no major problem we're seeing, we'll say, okay, can you just hold on with your old spectacles? 6 weeks after delivery, come in for another check, because sometimes you change glasses and the hormones are playing up and the glasses are either not effective or they are effective initially and after a while they are no longer so effective. So I don't know the particular story that was online about losing vision, but yes, it can happen. Even when women who have glaucoma prior to pregnancy get pregnant, we then have a dilemma, not just for glaucoma, for any health challenge. What can I use to manage this disease without affecting the baby? Because we are now treating two people, whether we like it or not. And so for some women who have glaucoma, we've actually had to stop their medications in the first trimester. Sometimes we monitor into second trimester. And when we feel, okay, this baby is probably well formed, okay, let's recommence medications in third trimester. That's a risk to the mother as well. And for some women, we say, okay, go and have selective laser trabeculoplasty. Let's apply laser to the trabecular meshwork. Use it to hold down the intraocular pressure as a way of managing the glaucoma during pregnancy. And after you've had laser, if the effects wear off in a year, you can go back to your medication, but we'll keep monitoring. So I think that motherhood pregnancy is a huge sacrifice, because some women will tell you, okay, I don't want to use this eye drop because I'm pregnant and the pressures are high and you're trying to balance. It's like a balancing game. How much time can I keep her away from eye drops to make sure she has a healthy baby and she's not losing vision and everybody's happy at the end of the day without risking her vision. So it's a difficult scenario. So there are indeed peculiarities in pregnancy that can cause visual loss. But that's the reason why I would advocate for gender-focused healthcare initiatives. A woman who is pregnant and needs laser should be able to access laser despite the cost of that laser treatment, because she's taking decisions to look after an unborn child and make sure an unborn child comes out healthy. It doesn't happen so often, but yeah, pregnancy is a risk factor for visual loss. Yes, it can happen.
Now, I'd like to know, so if these things happen in pregnancy, will it somehow reverse itself, or you need to actually make it reverse itself with attention, with care, and all of that?
Some of them reverse, like the general blurry vision, glasses not being effective, a bit of thickening of the cornea. A lot of them will reverse after delivery. Even the challenges with controlling blood sugar, it does tend to get better. And we didn't even go into the pregnancy-induced hypertension. Sometimes that also reverses with pregnancy, but it's not an immediate thing. It can take 3 months, it can take 4 months. For women who had pregnancy-induced hypertension that progressed to eclampsia, who had to have a CS, sometimes we see them and we can see the signs of severe hypertension in the eye. We can see disc swelling. We can see bleeding in the eye, at the back of the eye, on the retina. We can see exudates. We see things that are there. A lot of them will reverse, and then those that don't reverse, that are persistent, we've got drugs we can use, we've got laser we can apply, we've got injections we can give. But because a good number do resolve over time, we tend to wait and watch and let the body take care of it as much as it can, and then we intervene when there's a need to. But unfortunately, within that period we're waiting, this woman has poor vision. She's probably gone from reading the charts to just being able to count fingers at 2 meters or 3 meters. And so she's struggling with navigation, struggling with getting back to work. But it's not a hopeless situation for most people. Most people, there's a reversal. And for those that the reversal is either incomplete or it didn't happen at all, there are options for treatment.
Thank you. If you have any questions or contributions, the WhatsApp line is 0809 444 0981. Again, the WhatsApp line is 0809 444 0981. While the call line is 0201 448 9981. Now, I'd like to move to the one for menopause. So, because I know you mentioned dry eyes earlier as part of the ones that happen with hormonal changes. So what are those possible things that can come with menopause? And again, will it reverse itself at some point, or you have to manage it?
For menopause, we have to manage. It doesn't reverse. But most of them are not so severe to need hormone replacement therapy. I think the eye changes, but there are other things, body changes, hot flushes that come with menopause, that the memory issues that come with menopause, and all of that. Some people might actually need hormone replacement therapy for that. But for the effect of menopause on the eye, sometimes it's not that severe. And even when it is, there are options for treatment as well. And we know that with menopause, we entered the stage where there are age-related eye conditions coming up. People are beginning to develop cataracts from about the age of 50. But cataract at about the age of 50 is still correctable with glasses for a lot of people. But then we know that everybody's not the same. Someone may have immature cataract for 10 years and she's still seeing the whole chart with her glasses. and someone may need cataract surgery at 52. So everybody is different. And I'll just say regular eye checks, regular examinations, see your ophthalmologist, so that if there's need to intervene either with drugs or with surgery, it can be done pretty early.
All right, thank you. Hello, good morning.
Hello, good morning.
Good morning. What's your name and location?
My name is Kate from Cotton.
All right, Kate, please go ahead.
Please, I'm pregnant and I have a cornea opacity.
You said?
Cornea opacity.
Okay.
I don't know how to ask. Is it possible? Can it affect the baby?
All right, so she would answer.
Can it be inherited?
Okay. All right, so stay tuned for her answer. Thank you for calling. I'm not sure you heard that, did you?
She had something and she wants something to affect the baby.
Yeah, so she's pregnant and she has cornea opacity. Now she wants to know if it can be, if it is can be transmitted, yeah, and if the baby can take it from her.
Okay, it depends on what caused the corneal opacity and how long it's been there. The cornea, like I said, it will always react to infection, injuries, possibly by becoming slightly opaque. That's how it responds to trauma. So if this opacity was from an injury, it's not transmissible. If it was as a result of measles keratopathy in childhood, it's not transmissible. If it's a hereditary corneal dystrophy, that's a genetic cause of corneal opacity, it may, depending on what the genetic mode of transmission is, it may be transmissible. But that's actually not very common here. And some of the hereditary corneal dystrophies or issues come with aging. It's not likely that a child would just come with a corneal opacity because the mom had a corneal opacity. It's rare, very unlikely. But then some children can come with corneal dysgenesis. They are born with an anomaly, so they have a corneal opacity. And the mother doesn't have to have a corneal opacity for that to happen. So I think she should, not be afraid. And I don't know the history behind what happened to her. But most causes of corneal opacities are not genetic. And even the genetic causes are not very common in our environment.
Thank you. We hope your fears are allayed, and importantly, we hope that you seek more information. We have 2 minutes more to take your questions and anything you'd like to clarify on Soul Sisters for today. So if you can quickly get a call in, or you can send in your WhatsApp message. The WhatsApp line is 0809 444 0981, while the call line is 0201 448 9981. Again, 0201 448 9981. It's been very, very enlightening. Hello?
Hello, I'm calling back.
Okay, please go ahead.
Is it possible?
Oof, if you can call back, I would appreciate it. The line went off, so you might need to quickly call back in, Kate, and any other person who's trying to get in. 0201 448 9981. I am going to try to give you some bit of seconds so that you can quickly get your call in. But I guess we've touched on all the major parts and the major things we need to address. And the key thing is for people to seek more information, right? For them to,
absolutely.
To always, Okay, let me quickly take this calls. Hello, good morning.
Hello, this is Kate calling back.
All right, Kate, go ahead.
Please, is it possible I get her contact so that I can tell her the full history of the corneal opacity?
Yes, so you can, after the conversation, we're going to tell you how you can reach her online.
Okay, thank you very much.
All right, take care. Hello, good morning. Eesh. Okay, I guess too many calls are trying to come in at the same time. So for the sake of Kate and anyone who's trying to get more information or reach you, how can they reach you?
Online, Instagram, they can send me a DM at Chigozie Mbadugha Author or at Canva Books.
Okay, please, I'll need you to say your handle again and maybe spell it.
Okay, let's say at Canva Books, that's shorter. So at Canva Books, at C for cat, A for Amber, M for mother, B for brother, A for apple, BOOKS, books at Canva Books. So send me a DM, I'll try and respond quickly. I'd just like to say this as a parting shot. Please, as women, let's not run away from eye care providers, from healthcare. If you're seeing something you're uncomfortable with, please see someone. The earlier it's picked up, the better. Ignorance is not bliss. Okay. And people say, oh, it's not paining me, I'm not having any pain. That's why I didn't see a doctor. The more treacherous conditions, actually the ones that don't cause pain. So we do need to make sure we see someone and keep seeing someone till we have an issue resolved.
I feel like women need to be told love your neighbor as yourself more, because many times we love others, we don't love ourselves. So the kind of care, attention that we give to others, I think we should give it to ourselves. And yeah, let's not be hypocritical and empty ourselves.
I totally agree with you.
Thank you so much for your time this morning. It's been very beautiful. And I look forward to more conversations with you on the topic of eye health and more.
That's fine.
Thank you.
Thanks for having me.
It's a pleasure. All right. So thank you, soul sisters and the soul brothers in the background. We know you're there. Thank you for being a part of the show. Next week, we'll go again from 11 till 11:50 right here on the station that loves music and loves life. Now, 12 o'clock is the time for me to play you great African music on the Casbah. And you know, we'll do that for 4 hours. My name is Oluwaseun, and please take care of yourself. Thank you.
Welcome. You're very welcome.
So I don't know if you'd like to have the YouTube recording later on. I could send you the link to the conversation in case you just want to have it.
Yeah, I'd like to. I'd like that very much. Thank you so much. And please don't be scared of pregnancy. Don't be.
I will try.
Right. Don't be scared. To be fine.
It will be.
Yeah.